Hello and welcome to the Alliance for Hope International Affiliated Centers webinar series. My name is Rayanne Passantino and I am the Assistant Director of Family Justice Center Programs for the Alliance. I'm excited to host this series that will showcase each of our affiliated centers by giving them an opportunity to share information about their sites and the work they are doing in their community. For more information about becoming an affiliated center or creating a center in your community, please visit our website at allianceforhope.com. And now I have the great pleasure of introducing Anne-Marie Delaney, who will introduce herself and take you on a tour of the Family Justice Center of Boston. Take it away, Anne-Marie.
Thank you very much, Rayanne. I'm delighted to share this PowerPoint presentation about the Family Justice Center of Boston. This first screen that you're looking at is the aerial view of our fair city. The waterfront is in the foreground, and while you can't see it, the FJC itself is in the background to the left of our Charles River. And this is a picture of our organizational chart. We are a program of the Boston Public Health Commission, and we sit within the Division of Violence Prevention. I have 3 staff, the training coordinator and the 2 staff assistants. So there are 4 of us who are employees of the commission. The other partners are distributed there. There are 5 agencies that provide services for victims, survivors of domestic violence, 2 that provide services around sexual assault. 1, the Children's Advocacy Center, is providing services for children who have experienced sexual abuse, and there are 2 providers on site for folks serving victims of human trafficking. There on the bottom, we aim to be culturally specific non-profit organizations co-located with law enforcement and our local health department, providing safety, health, and support for victims, survivors, and their families towards their individual and community health healing. As said, we're within the Boston Public Health Commission. On this diagram there to the right, there are 6 bureaus at the Health Commission. We are at 5 o'clock. Our Division of Violence Prevention sits within the Division of Child and Family Health. And as you can imagine, with 1,200 employees of the Commission, we have significant opportunities to take advantage of resources and services available in each of the bureaus for the benefit of our clients. Over a significant period of time, having been established in 2005, one of the first FJCs in the country, we did undertake a strategic planning process and created both mission statements and vision statements for our division and for the Family Justice Center as well, which you'll see later. The programs within the division are listed here. The ones that we work quite closely with include we work closely together with all of them, but we're very often working with the Defending Childhood Initiative. Folks may know there are 8 sites in the country funded by DOJ. The initiative is designed to prevent and reduce the impact of exposure to violence in children 0 to 17 in their homes, schools, and communities. There's a picture there of our Start Strong group. Start Strong engages youth in and out of school. They have older teens that act as peer leaders in their communities, and they work together on creating media campaigns aimed at preventing dating violence and increasing healthy relationship skills. And the Violence Intervention and Prevention Program, there is a ad campaign there on the bottom developed by that group. They work in 5 micro neighborhoods, averaging 900 households, selected because of high rates of gun violence, but strong community infrastructure. What they do is they take violence prevention and strategies that seek to reduce community violence through mobilization of community-based organizations and residents, increased coordination of city agencies, and increased availability of knowledge of existing resources. And here is our Family Justice Center. We are at 989 Com Ave, there on the top left. On the right, you'll see our Dress for Success is headquartered in our building. The boutique empowers women to achieve economic independence by providing a network of support professional attire and the development tools to help women thrive in life and in work. On the bottom right is our pediatric sexual assault nurse examiner who provides forensic examinations, medical care, and emotional support for children up to age 17 when there are concerns or disclosures of sexual abuse. They are a provider within our Children's Advocacy Center, which is fully headquartered here. And bottom left picture is one of our 3 training rooms. I will be sharing more about the degree to which we are a training hub in the areas of discipline I referred to. The vision statement that we created with the under the stewardship of the FJC Council, which is comprised of the leadership of all our on-site partner agencies. Through that strategic planning process, we created the vision statement. I'll leave it there for a moment, but let you read it on your own. What we determined in terms of the collaborative approach that we would take to our work is each of the providers, of course, provides the direct services. The areas that we determined that we would collaborate on and create annual projects are on training, advocacy, and policy that legislation as it pertains to sexual assault, interpartner violence, child abuse, and human trafficking. Data collection so that we have an understanding of citywide prevalence and the location of these types of issues where resources need to be directed accordingly. And public awareness, oftentimes taking the shape of public awareness transit ad campaigns. This is our list of partners, as I mentioned, in each of the categories and into each of the disciplines, and our front desk, where one of our 2 staff assistants are shown there. Of course, is a list of the services that we provide and to whom we serve, the various languages we're able to provide services in. Of course, services are provided free of charge for all residents of the city and beyond, including immigrants regardless of their immigration status and members of the GLBTQ communities. In 2017 fiscal year, collectively our providers touched the lives of 5,326 clients. This is an example of the couple of programs and initiatives that are focused on providing services and support for victims or those who are at risk of being exploited commercially and sexually. I'd say in terms of our city, there's wide, significant city support for this work. We did open the first shelter, one of our partner agencies, for women involved in the sex trade. We opened this spring, and we're currently involved in an initiative that is hosted or sponsored by the Massachusetts Trial Court, where they're developing strategies that provide services and resources for women involved in the sex trade and who are also involved in the legal system. I shared that the strategic objectives that the council highlighted were in the areas of training and public awareness, et cetera. These are 3 projects that we funded this year. My Life, My Choice and Dress for Success here on site worked collaboratively on a leadership development program that employs the youth that are being served by My Life, My Choice and trains the providers in Dress for Success to work effectively with those youth. Casa Mirna and the Boston Area Rape Crisis Center worked together on designing and facilitating Title IX workshops with youth for local high school students. And while Title IX lays out how school authorities must respond to sexual or harassment and violence that impacts a student's ability to engage in their education, there's a significant public dialogue happening, but it does not directly address high school students. So this is a project that attempts to bridge that gap. The Children's Advocacy Center, working with the Massachusetts Alliance of Portuguese Speakers, is working together on developing culturally specific resources for child victims of abuse and exploitation. With regard to the training that happens in the building, this is showing that in fiscal year 17, there were just short of 800 individuals trained, both providers, residents, on the topics related to domestic violence and sexual assault and human trafficking. We have several training committees that look at our space to ensure that it is trauma-informed, that prioritize what training should be happening and where we can increasingly collaborate, and focusing specifically on promoting equitable access to safety and healing. We did also launch the FJC Training Institute this year. There were 2 pilots there were 33 participants in the 2 pilots from 20 agencies. You'll see that the outcomes of the training, and I should say that this training was developed at the request of providers and informed by providers. There were several focus groups held with all agencies that then sent staff to the pilots, and you'll see that the outcomes are showing increase in all areas related to understanding ways in which racism impacts safety and healing, how culture, race, and racism affects our work, and developing strategies to reduce the barriers. That is my presentation. You have information there on how to reach me and our training coordinator, and our website on the Boston Public Health Commission. We'd always be happy to share more information about how we're structured and how we work, and I'm very grateful to have this opportunity to share. Thank you, Rayanne.
Thank you, Anne-Marie. That was great. One of the things I appreciate about your center, and I noticed it when I was looking at the website, at your PowerPoint, is that tell me a little bit, or tell us a little bit about how, or what the reaction is to having one of your staff assistants be male, sitting at the front desk as part of the welcoming committee. How does that work?
That's a great question. There was, we for some amount of time, the first several years, we did only have female staff assistants, and as somebody left and we went into rehiring for that position, we had this fabulous applicant who had done a tremendous amount of work in hospitals doing client directing, helping them sort of navigate that system. And we felt that while the predominant number of clients that we see are women, it's certainly, as we all know, men are impacted significantly, and it has been met with appreciation and sort of a new ability to reach out and connect meaningfully to all clients.
That's wonderful. I really love that. It's so unique. What is one piece of advice you would want to share either with open centers or with centers that are in the development phase?
Well, I think that maybe some of the answers are true for all parties, and we continue to work down that list itself, including to have a strategic plan, to cultivate your champions, to really ensure that you're relevant to the community, that the work is informed by residents and by survivors, to throw your net wide on developing stakeholders, and I would say network.
That's true. Very good. Thank you so much. And thank you everybody for listening and watching this webinar. And we will be posting more webinars with more of our affiliated centers in the upcoming months. Take care, everyone.